Hi, everybody. Today, we're jumping into 5.3, classifying and explaining psychological disorders. Our objective is to analyze the diverse approaches used to define and classify psychological disorders. We're going to learn how the 7 different perspectives in psychology view disorders and how they view them differently. And we're going to learn about the DSM-5 and how doctors and clinicians use how they diagnose people with a certain disorder. All right, let's jump into all of the vocab for 5.3. Here we go. Abnormal psychology, just abnormal means not normal. So abnormal psychology is related to not being normal. If you're behaving differently, if you're breaking lots of social norms, if you're over emotional, you're showing more emotion than normal people do, or your thought patterns are different from normal people. Maybe you have more depressive thoughts or more anxious thoughts than the regular person, then you might find yourself trying to get help from the branch of abnormal psychology. This is the study of psychological disorders, essentially. Clinical psychology is the branch of psychology that assesses, diagnoses, treats, and prevents mental, emotional, and behavioral disorders. So a clinician is like a counselor or a psychologist who is there to help you when you find yourself, if you find yourself uh, off the path of normal emotions, normal thoughts and behaviors. Then you want to go to a clinical psychologist. These are all the jobs that you can do if you go into clinical psychology or abnormal psychology. Uh, there's a lot of different things you could do with that. Psychology is good. You should major in psychology. Before we move on, I want to give a quick warning to everyone of a common phenomenon in psychology called psychology student syndrome. This is when you learn about all of these disorders. We're going to learn all about the abnormal, right? Every mental illness and disorder like anxiety and phobia and depression and ADHD. And every year when I teach psychology and when everyone teaches psychology, when everyone takes psychology, you'll be inclined to think you have a disorder or someone that you know has a disorder and you're trying to diagnose yourself or diagnose them. But just remember that I'm not a doctor and you're not a doctor, and neither of us are specialized clinicians that can make a diagnosis. So even though you'll be inclined, it's called psychology student syndrome when a student is inclined to diagnose themselves and others. Please don't. Psychology student syndrome, let's avoid it. So the DSM-5, this is a very important book. This is the book that psychologists use with all of the classifications of every single psychological disorder, and they use this book to diagnose patients. Okay, they use this book to diagnose patients. It does not have any treatments listed in this book. This is an AP question. It doesn't have any treatments. It just has definitions of every single psychological disorder so that doctors, clinicians can use it to diagnose individuals with psychological disorders. So it's just kind of the dictionary of the Wikipedia of all disorders without treatments. It just explains and defines a disorder, but it doesn't offer how they are treated. That's a different book. Okay, another thing that doctors and clinicians use around the world is called the ICD. So this is put out by the World Health Organization. This is another AP question. Watch out, they'll get you. So the United States uses the DSM-5, and the rest of the world uses the ICD. America is special. They use the DSM, and everyone else, the World Health Organization, these countries use the ICD-11. This is a global standard for reporting and categorizing diseases. That is used by healthcare professionals to diagnose conditions and track health trends worldwide. So kind of the same thing. American DSM-5 is put up by the American Psychological Association. And then the worldwide one, the World Health Organization one, is called the ICD. These are books that psychologists use to diagnose people with psychological disorders. Okay, so just another thing that we briefly need to talk about is the difficulty in defining normal. How do we know what is abnormal? Because everyone has anxious thoughts and everyone has depressive thoughts from time to time, but that doesn't mean they're anxious or depressed. So that's why these books are necessary. So there's a clear definition of abnormal, so that clinicians can use it to properly diagnose someone. Even if you think you're depressed, it doesn't mean you're depressed. It might mean you're normal. Deviation. You know, deviation from the mean, which we learned in Unit 0, and regression to the mean. So deviation is when something goes away from the mean. If you deviate from the normal, it means you're acting differently or doing something that is uh, not normal, not the mean. It's a significant departure from accepted social behaviors and cultural expectations. So deviation, when it comes to mental disorders, if someone is too disruptive or somebody swears too much or somebody seems to be really forgetful, or if somebody seems to be really anxious or really depressed, they've deviated from the mean. They've deviated from the normal, and that'll land them in the category of abnormal. And they'll get a diagnosis from the DSM-5 if they're in America. Distress, we already learned what this means, is the bad type of stress, intense and prolonged emotional suffering. Dysfunction, so distress is just stress. It's like emotional suffering. It's all in your head, distress. Dysfunction is when you can't do something because of the distress. You're so distressed that you can't even come to school. That's a dysfunction. You're so distressed that you can't even, eat your breakfast. That's a dysfunction. It's a disruption in the cognitive, emotional, behavioral functioning that significantly impairs an individual's ability to perform normal day activities. So if you feel like you can't do something anymore, that's a dysfunction. I can't wake up, dysfunction. Stigma is another important topic when it comes to mental health. There is a stigma, which means a negative stereotype, or basically a negative worldview of people who have disorders. Like if people have been diagnosed with anxiety or depression or PTSD, there is a social stigma against them, like they're broken, or there's a view that something is wrong with them. And there's a view that it's their fault that something is wrong with them. There's a lot of stigma around mental illness still, and especially where we are. If you're watching this from South Korea, there's quite a stigma on mental illness. So yeah, stigma, a negative stereotype, a negative view. And people with mental disorders are often worried about being discriminated against because of their mental disorder. So here are the 7 perspectives in how they explain disorders. The biological approach explains disorders as a lack or an abundance of neurotransmitters. So from the biological perspective, they say something's wrong with your brain. It's not your fault. It's genetic. You're genetically inclined to be more depressed than other people. And it just so happens that you have less serotonin than other people. So it's a biological perspective. So a biological psychologist might say you should take some medicine to help with the neurotransmitter imbalance in your brain, and that will help you. That's a biological perspective. Something is genetically wrong or chemically wrong or biologically wrong, and you need some medicine to reset biological perspective. Then there's the behavioral perspective that suggests that mental disorders arise from maladaptive learned behaviors and associations. So we haven't learned behavioral psychology fully yet. We will, but basically everything is related to rewards and punishments. You are the way you are because you've been shaped your whole life through rewards and punishments and just associating two things together, focusing on how inappropriate conditioning and reinforcement of behaviors contribute to psychological issues. So it might be parenting, or it might be the school that you grew up in, but you learned to be the way that you are throughout your life. That's what the behavioral psychologist is interested in. The psychodynamic perspective, we know the psychodynamic perspective is interested in the unconscious mind and the subconscious mind and unresolved conflicts from childhood. Right? So a psychodynamic perspective would say, it's not your fault that you are the way that you are. Something terrible happened to you as a child, or many terrible things happened to you as a child, maybe adverse childhood experiences, and those have shaped the way you are and have shaped the disorder that you are now dealing with. The humanistic perspective, right? There are Maslow's hierarchy of needs, the pyramid, and the humanistic perspective of disorders would say you are not able to reach your full potential under the conditions that you're in. So mental disorders arise when individuals' innate potential or self-fulfillment and personal growth is blocked. So you're living in a situation where you can't reach your full potential. You need to get out of that situation and get into a situation where you can continue to rise up the pyramid. You're not getting your needs met. That's why you are depressed or anxious or have PTSD, etc. You got to get out of that situation and get into a situation where you can meet your full potential. You can self-actualize. Humanistic. The cognitive perspective would say it's the fault of your thinking patterns. Okay, cognitive perspective is about the way you think. So mental disorders, anxiety, depression, PTSD, phobias, etc., ADHD, are caused by the way that you think, maladaptive thought patterns. So bad thought patterns. We get in these thought patterns. We have these loops of negative thoughts that are hard to get rid of. And some people spiral into more and more negative thought loops. And the cognitive perspective would try to help those people by helping them think in a more optimistic way or helping them see the world in a more positive way. The cognitive perspective says disorders are shaped and caused by our negative thoughts, our negative thought patterns, which most of the time we have no control over, if ever. The evolutionary perspective suggests that mental disorders can arise from behaviors and mental processes that are maladaptive, reducing individuals' chances of survival and reproduction. So the evolutionary approach might say anxiety and depression are normal. They're normal bodily responses to warn us that something is wrong in our lives and that we need to change, right? The evolutionary perspective is all about survival, and it's saying we need to survive. So if you have social anxiety disorder, maybe that is a warning from your body to get you out of that situation to help you survive. Evolutionary perspective. The sociocultural perspective is, you can probably guess, society and the environment are having an impact on you and therefore your mental health. So you're living in a broken home, you have a terrible family life, your school is terrible, you have an abuser, all of these things, your environment is harming you in some way and limiting you in some way. The people around you or the culture that you're in doesn't fit who you are or who you want to be. That's the sociocultural perspective. The eclectic approach is basically you take all of the approaches combined on trying to help somebody's mental disorder and you combine them. So the eclectic approach would be like, you come to me, I'm a clinician, and you come to me and you are depressed, and I'm going to give you medicine, biological approach, but I'm also going to do some talking therapy with you, cognitive approach. I'm going to try to get you to see the world differently in a more positive way, cognitive approach. And I'm going to suggest that you move schools, sociocultural approach, right? So if I'm a doctor, I want to use as many techniques as possible to try to help somebody, not just one technique. I don't just give somebody medicine and hope for the best. I got to give somebody medicine and try some other useful therapeutic techniques that might help somebody with a mental disorder. That's the eclectic approach, a combination of approaches to solve or treat a disorder. And the biopsychosocial model is a combination of understanding all of the perspectives. So when you're trying to understand a mental disorder, you're combining all the approaches to help you understand them. That's the biopsychosocial model, right? Disorders aren't just caused by one thing, they're caused by a multitude of combinations of things. And the biopsychosocial model is just like, okay, we have to understand the disorder from all of these angles. Finally, I think this is finally the diathesis stress model. It's a psychological disorders arise from a predisposed genetic vulnerability. Vulnerability means diathesis, like how likely are you genetically to get a disorder or a disease? Some people are more genetically prone to get cancer than other people. Some people are also more genetically prone to get depression than other people. So the diathesis stress model is how your genetic vulnerability, diathesis, interacts with environmental stress. So the environment and your biology are interacting at all times. And some people are exposed to the same environmental factors, and one gets depressed and one doesn't, right? So the only difference there is their biology, their genetic vulnerability, diathesis. So the diathesis stress model studies how the biology of somebody and their environmental influences interact to cause the disorder. Thank you for listening. That's 5.3. I hope you all have a wonderful day. Bye-bye.